Hi, welcome back to Rohrich Knows Podcast. I'm Dr. Rod Rohrich. I'm a board-certified plastic surgeon in Dallas, Texas. Let's talk about the unhappy patient. And everybody has unhappy patients in their practice, especially if you've been practicing a long time and if you're being upfront and honest, because nobody's perfect. And as a board-certified plastic surgeon, you know, I've done over 30,000 operations, and of course, you know, a majority of the patients are happy and satisfied with their results, but as you know, we're all human. So sometimes patients can be unhappy even if the results are good. Sometimes they can be unhappy if the results are not so good. So these are some concepts that I think are very important to consider for both the patient and the surgeon and the viewer on how to really think about it. Because number one, nobody's perfect. I'm an excellent plastic surgeon, and I do operate every day, but have I ever done a perfect rhinoplasty or perfect facelift? No, nobody has. You know, we're not God. You know, hopefully he helps us, but we're not God. So I think these are some of the concepts that I think are very important, and that's really trying to be an active listener. And as a type A personality, that's sometimes hard to do. You really have to allow the patient to speak to you without interruption. And I think that's really important because I want to hear exactly what the patient is thinking about or has concerns about. And I can tell you that's very important to do. And I talked to one of my patients who's early post-op on FaceTime today, who is in Europe, and she's only like 4 weeks after her rhinoplasty, and so she has concerns about her tip swelling. And of course I said, you know, I listened to the entire time, but I said, yes, that is totally normal, and it's something that is totally expected to see, because in the preoperative informed consent, you always talk about how long it takes for swelling to go down on the nose. Especially in primary rhinoplasty, it takes a year or 15 months. So you have to be able to make sure you listen to what they say and then answer saying it's actually normal. And if it's not normal, you tell them. So, and then also, you know, really, you want to really try and be empathetic and compassionate. And I can say, you know, you have to say, okay, if this is something, if you have a residual bump on the dorsum of your nose after a rhinoplasty, you can say, yeah, this can be upsetting, and I understand it. And you have to be able to see it and to relate to it and say, okay, I get it, I understand it, but guess what? We can fix that. In 6 months, we can do a minor procedure where we can just rasp it and actually make it better. So I think you're trying to help the patient find a solution. And then being able to really clear communication. And this is where a lot of us as physicians fall down because we use medical jargon. You know, you don't want to use things like, you know, lower lateral cartilages and septal extension. You know, you want to use simple terms that actually make sense. You know, and things like the example I mentioned about swelling. Swelling takes a long time. Now, the nose takes the longest of any organ because it's the further out in the nose and the blood supply is not as good as someplace else in the face. So, you know, the key is upfront telling the patients exactly what to expect. Now, many times patients don't recall that. That's why there's an informed consent. That's why there's preoperative written informed consents. There's also consents on postoperative care. It's on my website. It's on my YouTube channels. But sometimes when all else fails, I always tell my patient, just text me. And I think it's a real relief because they can say, hey, Dr. Rohrich, I'm 3 months out and I'm living in LA and my tip is still swollen. And I'm saying, that's okay, that's normal. Or I'll FaceTime them and say, listen, let me see what we can do. So, and then reviewing expectations. You know, this is really important. And I think, especially in my rhinoplasty patients, you know, to really go over what you can do and what you can't do. That's why I always ask my patients the 3 top concerns they have. And my goal is to try and fix every one of those top 3 concerns. And then also in patients, especially secondary patients, it's the 3 things you can't do, because you have to be informed about what to expect and what not to expect. And I actually talked to another patient today that was in another country, and she's now a year after her facial rejuvenation, and she still has a little swelling and she has a little fullness in her neck. And I said, yes, you know, that can be something that, if needed, we can do liposuction on, and we can contour it. I mean, the rest of her result looks great. But again, you have to match what you talked about pre-op and what's possible and what's not possible. And you see that a lot with rhinoplasty. And the biggest impediment in rhinoplasty is swelling and postoperative scar formation. And of course, you know, I always tell my patients, I will never leave the operating room until it looks as perfect as it can look, and then it's up to God and wound healing, because that's really the most important thing that you see, is that it's how it heals. So you have to review that. And then if the patient's in person, it's important to examine exactly what the concern is. So let's just say that the nose is deviated after you've seen the patient and she has slight nasal deviation. Of course, you're gonna say, listen, of course, you have to recognize that, yes, we do have some slight nasal deviation. If it does not fix itself, or the swelling doesn't go down in 12 to 15 months, of course, we're gonna be able to do something with that. We'll fix that. So evaluate the patient. And then offer a solution. I mean, I always tell my patients, you know, if after 12 or 15 months, if we're not happy, we'll do something. We can do a revision. And many times it's a minor type of revision that's needed, whether it's going to be debulking of the nasal tip or dorsal irregularity. Those are things that we can fix. And I think that's really, really important, to offer a solution to the problem. And then the next thing is just set realistic goals about what you can expect and what are the limitations, because, you know, like I said at the beginning, no one can ever have a perfect result. The nose is not going to be completely straight. The nostrils aren't going to be completely symmetrical. Nobody is, because the beauty of Homo sapiens, of us, is that everybody's asymmetrical. And I addressed that in another podcast coming up, is the beauty and power of facial asymmetry. That is so important. And then I sometimes do this, is if they are still asking for other, or have other concerns, I say, hey, I'll refer you to another colleague that I respect, who's another expert in rhinoplasty or facelift surgery, and get another perspective, because I'm always open to anything else that we can do, because the bottom line is we're here to help the patient get a satisfactory result. That's really the most important thing to do. And if you do that, I think that's very, very important. And of course, remain, you know, professional, stay calm. And you know, the biggest thing is, you know, I understand patients' frustrations, and you know, we're here to help them get through this. And I think that's really the most important thing we can do every day. So I would say that, and following up, and again, we can talk. You know, I have my patients FaceTime me, text me, and, you know, just assess how you're healing and how we can discuss any further type of follow-up that we can do. And, you know, a majority of time, this works well, because in patients that are rational, that understand the power of wound healing and the power of how patients heal is different and it's individual, that's important. And I think these are some 10 key guiding steps that really, I think, will help you as a patient when you talk to your surgeon about, you know, your result, whether it's, you know, something that you want to have revised or something that you would benefit from. I think this is a very rational and powerful way to follow up with your surgeon. So please give me your comments and your thoughts. I know this can be a very, very sensitive subject because of the time that, you know, patients can come in, and half of my practice is patients that I operate on that have had revision facial surgery, revision rhinoplasty, revision surgery. And my goal is to help them improve on their result, because none of us were there at the initial surgery. So the goal is to basically say, hey, we're going to start with a clean slate, and we're going to move forward and see if we can get you to a happy place and a happy, more satisfactory result. So give me your comments, give me your thoughts, and until next time, stay well informed and stay educated.